Broadway. We're by Penn Station and Grand Central and Port Authority and most all subways, buses, and trains that come to Times Square and Herald Square. So we're easy to get to. We have new technology. We have a spacious cancer treatment center where you will not get lost. We know who you are and you'll know who we are. We have hyperthermia, linear accelerators, CT scans for mapping out the radiation. We have pretty much whatever you need for cancer treatment, non-invasive treatment. If you give us a call during the week, we'll send you a booklet and DVD. And if you have medical questions, you're welcome to call us anytime at 212-CHOICES, which is 212-246-4237. Here's some new voices.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, it's Gil Lederman, Radiosurgery New York. Dr. Lederman talking about news and articles and medical cases. Taking your calls, by the way. Bob and Ed are running the studios. We're here at WOR, which is in the heart of New York City. If you have questions, please call us up, because Bob and Ed are working hard, but they have time to take the calls. So our number at WOR is 800-321-0710. That's the studio number while the show is on, 800-321-0710. 800-321-0710. We had a woman come in. She's an American-born woman, 76 years old. Her family is German by origin, and she presented with a lump in her breast. Now, she hadn't had mammograms for many years. She presented with this lump. She was staged up. She had a biopsy of the breast. It showed cancer. This was elsewhere. She did not come to us. It all started a year ago. The cancer had traveled to the lymph nodes in the chest. She started on hormonal therapy, and then she went to Germany for photodynamic therapy. Now, real photodynamic therapy was a technique tried in this country about 25 years ago, and the idea was to give a chemical, and the chemical would get in cancer cells and then be activated by light. So it was mainly used for esophageal cancer and superficial cancer that you could shine a special kind of light on. Well, this woman had what was called photodynamic therapy, but I don't really believe it was photodynamic therapy because she had cancer like in the center of her chest or in her armpit where you could not shine the special light, and the treatment really doesn't work. Anyway, they took a lot of her money, thousands of dollars, and she had a follow-up scan, and then by October, the cancer in the breast was worse, the cancer in the chest was worse. She started on different kinds of therapy. She started juicing, she started vitamins, antioxidants, and even started some chemo. So she tried chemo, hormonal therapy, juicing, antioxidants, so-called photodynamic therapy, and nothing worked. The cancer came back. She came to see me. What I recommended for her is she gets staged up so we know exactly where the cancer is. I can tell you, like I told her, that even though she has stage 4 breast cancer, where we treat, and we treat many women with breast cancer, our success rate where we treat is approximately 90%. So there certainly are options available. Radiosurgery is non-invasive treatment. There's no cutting, no bleeding. We hit the cancer. People come for a treatment. It takes about 15 minutes. They lay down in a special customized frame. We hit the cancer. They get up and go home or go to work or do what they want to do. We had a man who flew in recently from Florida. He had rectal cancer. This is a man that had had rectal bleeding and symptoms. His daughter pushed him to have colonoscopy. On the first colonoscopy, he was about 82 years old. He was found to have a rectal cancer that had spread to the liver. He started on chemotherapy, and some of the tumors responded, and the big tumor in the liver did not respond. His in-laws is one of my patients who's done very well with radiosurgery, also for colon cancer. So one patient suggested to another patient, his daughter's grandfather-in-law, that they should come to Radiosurgery New York, and he flew up from Florida, and he had 5 treatments for the cancer that was growing in the liver. He just had the treatment, 5 treatments. His last one was a couple of weeks ago. And he went back to Florida. He's going to get staged up. And we even talked about treating his rectum because his rectal cancer has not yet been treated. And obviously with chemotherapy, the results for rectal cancer metastatic are temporary. They're not permanent. Whereas with radiosurgery, our success rate is most commonly permanent success or control where we aim the beam. Another patient flew up from Tobago. Do you know where Tobago? I'm not talking about a bagel because I know you're all thinking about breakfast, but Tobago in the West Indies. Now, this is an interesting man. He's a 69-year-old man from the West Indies, black man, with elevated PSA. And I say black because we know blacks have twice the mortality rate of white people with prostate cancer. His PSA was elevated, and he can't urinate. Okay, and they did surgery on him in Tobago on his scrotum. And I said, what? Yeah, he said, on his scrotum. I said, why? He doesn't know why. So he had surgery on his scrotum, not knowing why. His brother heard about our work and encouraged the patient, his brother, to come to us, and he came to us. And we're calling Tobago to get the records. We can't figure out why the heck this man had this surgery on his scrotum because he was complaining of inability to urinate, which is really 2 separate places in the body. So what are we doing for him? Well, number 1, we are getting the records, which we get for all of you, and we'll give you copies of your records so you can read about what you have. Number 2, we're repeating the PSA. Number 3, we're evaluating the anatomy of the prostate and bladder to understand what is going on with him because he came with no records. And then we are trying to get his catheter removed so he can urinate on his own to find out what his PSA is and whether he has prostate cancer. So a lot is going on in this man, and we'll report back to you. He also can't hear in one ear. One day he woke up and he lost all his hearing and has tinnitus or ringing in the ear, which are often signs of an acoustic neuroma. So he may even have a brain tumor on his hearing nerve. We're working that up. We're evaluating his elevated PSA and his inability to urinate, and we're trying to discover what kind of surgery they did and what their goal was in the West Indies. And as I say, we'll report back to him and to you and get to the bottom of it. Next patient that I spoke to this week, very interesting man. He's 90 years old. So a lot of people say, doc, just get me to 70 or give me 5 more years. No. This man is 90 years old. He came with severe pain in the shoulder last spring. He had prostate cancer that was metastatic. So again, it's a sign it's not great to live your later life with pain and metastatic cancer. So it's a sign or a reminder, and studies show this for people who are screened and treated, survival rates are better than non-survival rates in non-treated people. So for this gentleman, he came in severely opposed to radiation. He was doing all kinds of things to get rid of the pain, which was terrible pain. He finally was convinced that he would try the radiation. I said, look, if you don't like it, you can just stop. You just don't show up. You don't like it, don't show up. That's it. Well, he had a treatment, and the pain went away by about 90%. It was a 10-minute treatment. He had a second treatment, and the pain went away nearly completely. And he thought radiosurgery is the greatest thing since sliced toast. He had terrible pain. It went away. And then he felt other pain. We treated a couple spots. He's doing great. He's fully ambulatory, fully functional. Great man, doing fine, probably in remission. So again, we'll report back to you. But even for the skeptics out there, and he was one of the biggest skeptics I've ever seen. He was fearful of radiation. He didn't want it. He now understands that radiation is safe, and radiation can be his friend, and radiation can take care of his pain. And when you do it with pinpoint treatment that just hits the cancer, not healthy tissue, there's less side effects, it's more effective, fewer treatments, non-invasive, no anesthesia. It's pretty good news. So we wish him well, and we'll talk soon. We have a caller on the line. Good morning.
Yeah, hello?
Hi, how are you? It's Dr. Lederman here.
Oh, hi. I got a large prostate problem.
I'm sorry to hear that.
And my PCA reading is
PSA.
Okay. PSA is about 9.1. It's slowly going up.
Well, that's not good.
It's not good. Well, what can you do for me?
Well, you should come in. That's the best thing. Come in, we sit down, we go over all the details, talk about the options, but normal PSA is considered up to 4. So your PSA is more than twice that. So number 1, you've got symptoms. Number 2, you're a man. Number 3, your PSA is very elevated. So you should come in. In fact, you may have prostate cancer. We would find that out, tell you all the options, tell you what your options are about finding out versus not finding out. If you have no cancer, then we would help treat you or direct you for treatment to help get rid of the symptoms. If you have cancer, we would try to treat you to save your life.
I think it's cancer. But
what's that again?
I don't think it's cancer.
How would you say that? How would you know?
Well,
Do you think cancer comes to you and pats you on the shoulder and say, "Mister, it's cancer. I'm here in your body"? Do you think it works that way?
Yeah, no.
It doesn't work that way. If you're waiting for a special message, it doesn't come. God is giving you the message. God is telling you your PSA is 9.5. God is telling you better get some care. God is giving you the chance.
Yeah, I heard that over 10 is dangerous.
Over 10 is super dangerous. But yours is already 9.5. It's the next door. The way it's growing, it's going to be 10 in a few months. God is giving you your message. You've got the message. And cancer doesn't say, "Mister, you cancer." It doesn't work that way. No, you've got the warning signs. You've got urinary problems. You've got elevated PSA. So you can sit home and argue all you want, and you're the President of the United States of your body, and you can choose to live or to die. You can choose to be worked up or not. But you've got all the warning signs. You've got as many warning signs as any man with prostate cancer.
take a piece out of me, right?
We don't take a piece. We put a little needle in and take a few cells out. So it's pretty simple procedure. We can repeat the PSA